Now, we in pharma spend billions of dollars trying to develop and commercialize a drug, but ultimately, we need access and affordability to drive prescription fills. And that's our mission at GoodRx, helping people with access and affordability. From researching their diagnosis, to consideration, to conversion, and throughout their patient journey, Americans rely on GoodRx, as patients are increasingly taking on the cost burden of their prescription medications. 21% of US adults have not filled a script because of cost. 39% are non-adherent because of cost. And that's why when we partner with pharma brands, we're able to drive powerful impact together. We integrate their access solutions onto our platform, whether it's enrolling in a copay savings card, or connecting them to a manufacturer-sponsored cash solution, or enrolling in a hub, or connecting them to any other patient support resource. We partner with pharma, and we help patients access and afford their drugs. We recruited an industry leader in data and measurement to run a study on one of our programs, and we compared test and control groups. We saw a 286% lift in scripts for patients who came to GoodRx. Now, let's welcome our two panelists.
I have the privilege of leading a small but mighty team of commercial innovators at AstraZeneca, where we are deployed out to our soon-to-market and inline brands to ideate, design, test, and hopefully scale the programs that make sense. But we look for what I call near-term innovations that transcend the traditional ways that brands go to market today.
At Sanofi, I'm responsible for the U.S. established products portfolio. It's a portfolio of a large number of legacy products. These are products that are a little bit later in their life cycle, but they still have access and affordability needs. These patients primarily are coming to GoodRx and other platforms, and they're looking for solutions. For my portfolio, what's important here is making sure that access is key. Patients that need them can get these medications. We've put in a lot of work and effort to build the brand equity, and now we need to maintain it.
What evidence are you seeing in your organizations that healthcare costs have driven patients to take on more of the role of a payer?
This year, 2024, it's been reported that over 20% of Americans have not filled one or more of their medications due to out-of-pocket challenges. And 10% of Americans have admitted to rationing their medications by reducing or skipping doses of their medications. These stats were consistent across all age brackets, but there was significant disparities between racial and income categories. There's nearly 51% of U.S. private sector workers that have opted into these high deductible health plans. The average out-of-pocket for these workers is $2,500 per year, compared to non-high deductible plans, which is between $0 and $750. The other evidence that we have in our own data at AstraZeneca is the consistent high demand for information about our products when it comes to access, formulary access, and affordability. The days of just asking for zip code level formulary access has changed, and our customers, our HCPs, are expecting information specific to their accounts. They want to know, based on their patient demographics, what is the access of our products.
Patients are paying more for out-of-pocket costs. I mean, every pharma company is paying tremendous amounts of dollars for data, right? We have our own in-house data. We purchase data on the customer journey. Within that data is information about copay, right, and out-of-pocket costs. So we know from this evidence that there is a rise, and you can also see it in some of the stats that you just shared about abandonment or not starting new prescriptions. I think the information that Dave shared is really important about the deductibles that these patients face, but actually it's over the course of the entire year that these patients are going to have higher out-of-pocket costs. First, there's the deductible phase, And then there's the maximum out-of-pocket costs. So the maximum out-of-pocket cost for these patients this year, for example, could be $8,000 plus if you're an individual, or it could be $16,000 for a family member. Now, extrapolate out a patient with comorbidities, multiple therapeutic needs for medications, or specialty medications like oncology products or other products. Now you've caused that patient to have really high out-of-pocket costs. For a long time in my career, I watched patients come stand across from me looking for medications that they couldn't afford. In those moments, it was really critical for me to help them because I actually took an oath as a pharmacist to help them. But that oath continues on today with what I do at Sanofi. So for me, that evidence that shows up in the data today means I have to act. And at Sanofi, we take that responsibility very seriously in defining how we're going to support that patient. This is through copay programs. This is through patient assistance programs. Many of our medications, almost all of our medications, if you go to the brand.com website, you're going to find some method of easing the burden of out-of-patient cost, for that patient.
I'll add to that, we're also seeing an increasing trend in formulary exclusions. 37% increase in the number of drugs that are excluded from payer formularies. We're also seeing a 45% increase in utilization management, prior auth and step therapy and all of that stuff. So you put all of that together, how has that changed the dynamics between pharma brands and the patient and the HCP?
That patient journey is critical. And what we're finding is that with a lot of the vertical integration that's happening today, with health systems and hospital systems acquiring physician practices, ultimately 50% of physicians now are part of a hospital kind of group. So they're not individual practices anymore. This makes it harder to see the physician. This makes it harder to help the physician understand what they need to know in that moment when they're seeing the patient. This is also increasing the volume of patients that those HCPs see. Therefore, there's less time that they're spending in the room with that patient. So first, you have to think about that HCP experience. Where are HCPs going to get their information, and how can we support them? Now, for the consumer, things are really changing there as well. They're definitely more educated. They're more savvy. Even seniors are using their phones to download copay cards and get information. They are looking to be informed and educated so that they can take the best advantage of those 7 minutes that they spend with their prescribers.
Data shows that patients making it to 1 year of therapy goes up 47% when a patient is taking advantage of a affordability program through a brand. So at the end of the day, they are very good programs, and it's important that they're being utilized. They're no good if they're not utilized. And the data does show that traditional ways of going to market with these programs, in-office cards, has decreased the impact. Let me start with brand.com is very important. It's a big part of brand strategies to go to market. They require a lot of effort. But what the data is showing, that's not the primary place that consumers and patients are going to do their research and evaluate their access to products, what their cost is going to be, and ultimately to get a savings card. What are the partners, obviously like a GoodRx, that they could be working with? So we're seeing some digital online pharmacies looking to take the mystery of patients walking up to that counter and getting that sticker shock, right? So we heard about what Amazon is doing, where it's more of a true coupon that we're used to in our consumer lives. And more organizations looking to make it easier for a patient to walk up and get that discount more immediate and reduce the burden on a pharmacy to have to back out a claim, re-adjudicate with the coupon as more and more patients are moving to that digital experience.
So we talked about what we're seeing today. Now we'll talk about what we're doing about it, and then we'll talk about where the puck is going in the future. So I'd love to hear your thoughts on innovative solutions and approaches that you are working on or you're seeing in the industry.
I think when it comes to innovation, it's difficult to find the right path forward because it's not a one-size-fits-all. Especially when I look at my portfolio, I have some products that go through retail channels, I have some products that are buy and bill, some that are specialty. So I think the right way to go when we think about the path forward is to really define what it is that you're actually trying to solve for and look very carefully at what is available in the market. Here is where partnerships have really helped us. We've done things to lower the cost of insulin. We've worked with GoodRx and other partners to make insulin available for $35. This is both for our commercially insured patients and for our cash-paying patients who often find themselves using GoodRx coupons. We've had really good success, right, on these programs. We know that we have a high success rate because we have a large amount of traffic from patients regularly going to GoodRx. We even know anecdotally that there are physicians going there and utilizing these coupons. So insulins is a great example of when you really need to innovate and make sure you're on the forefront, because the access to these life-saving medications is so critical for the patient. And we need to think about the solutions across all of these different types of medications. You know, Dave, you talked about pharmacies. If you're a pharma marketer and you're working for a pharma company, please don't forget that it's the pharmacist, whether it's retail or specialty, that is the last person that hands off your drug to the patient that needs it. All right, so what are we doing to improve their situation? How are we helping them? Because in the retail setting, you're right, you know, copay cards, they add a little bit more of a burden when pharmacists have to adjudicate them and then sometimes reverse them, or patients are bringing them in late. They're not coming through the EMR as part of the workflow so that they are there ahead of time. So there's a lot of work here that we need to do to figure it out and smooth that channel.
Collaborations, external partnerships is key to how we're changing how we go to market. Making these programs available through third parties. Once a consumer or patient enrolls into the program, it doesn't just stop with the savings. It becomes a bridge into the other solutions, such as education, technique, training on how to use a device or an inhaler, refill reminders, home delivery options. And you know, where I see the puck kind of going next is around transparency and optionality around pharmacy options, right? So we keep coming back to that, but the pharmacy is playing more and more of a critical role in affordability. Programs and teams thinking, these are all great resources by themselves, but will be even better if we bring them together. And I think that's where we kind of see some of the next generation go-to-market kind of strategies.
How do you know you're successful?
The success metrics around a core patient affordability program at their core probably have not changed, right? It's, are we reaching the appropriate patients? Are those appropriate patients enrolling? And then are they using the program? How is it impacting their adherence and their compliance to their therapy? And ultimately, are they getting the cost savings that we anticipated based on the existing coverage of the product? Which outlets are we in that are performing well? Which ones are we not in that we need to get into?
They see it and then they expand. They then integrate their copay savings card. They integrate their telehealth, right? So it's almost like you test it and then you expand.
The base KPI is always a script.
Yeah.
What's the dollar spent versus what's the dollar of revenue in a sale that's generated? But there's so much more that's happening, right? You've got non-personal promotion, you've got the field sales. You need to actually break it out and look at where the impactable sales are coming from and what you're allocating in terms of OpEx to each. Every pharma company, every brand, we are paying significantly for access. And so when I work with my marketing teams, you have to weigh that into the equation, because everything that you're spending in building that access and affordability program is in addition to what you actually paid for the formulary access. So ultimately, the gross to net, it's kind of an important thing to keep in mind, right, is being impacted. And I think the KPIs that we measure also need to change, because you need to look at it much more broadly, much more holistically, in order to understand what you're spending on and what your actual impactable sales really are.
In 5 years, how many direct-to-patient platforms do you think pharma will have?
Oh, crystal ball.
Look, I'm going to hedge my bets a little bit. I don't know, maybe I need to buy a scratch off, but I'm going to guess that everybody's going to have some sort of direct-to-consumer play.
It's a great question, and my answer is going to be it will be a standard go-to-market solution. I think it will become a core part of a brand's go-to-market strategy and techniques. I really do. I think the folks that are leading the charge today, from pharma suppliers or pharma companies to the suppliers they're working with, they're in their infancy, and I think their solutions and the speed at which they deliver those services are only going to get better, and I'm excited to be part of it. So my answer is I think it'll be standard in 5 years.